Welcome. We're here with Dr. Pam Lowe from Niles, Illinois. Dr. Lowe is going to talk to us about a really important projection for the future and for right now, really, and that's taking a practice into a more medical space. The opportunity is perfect, the demographics support it, and Dr. Lowe, you're the best person around to talk to us about it. Thank you for being here.
Oh, well, thanks, Marjolijn. I appreciate that. Yeah, practicing for 32 years now and 28 years with my own practice, you hope you learned a few things. And obviously the year of 2020 we thought would be very different for us as optometrists. It was our year to shine and really focus on the importance of comprehensive eye care. Then we were thrown into, having to shut down just for urgent care only. And I always like to look at the silver linings. And the silver lining of that is that patients and other healthcare professionals that we deal with regularly, our family physicians, our primary care docs, our internists, our rheumatologists, all realize, wow, those optometrists are really taking up the charge and keeping those urgent care patients during the pandemic out of the busy hospitals, ERs, and urgent care centers. And because we've always known that we've been able to take care of urgent care, but many of our patients and a lot of the public in general and other healthcare professionals weren't realizing that. So it was nice the pandemic shone a light on that. In the past few years, though, in my practice, we've always been medically oriented, but we really feel there's three key areas of medical optometry that are really important for practitioners to really take it to the next level. And when I say that, if you look at our young population, we know the epidemic of myopia is here. And who's better to take the charge of treating myopic patients than optometrists? It's what we've always done. Two of the treatments are contact lenses, and one is an eye drop that we've used for many years now. And with kids at risk for vision loss later in life, crazy that we're not making our practices a myopia center that parents can really feel comfortable, they'll be educated on that condition, and that we'll be able to treat their patients. So that's your young population. Mm-hmm. Then on the other end of the spectrum, we become a macular degeneration center of excellence, because look, as you practice, see whether you're a young doctor or a more seasoned doc like me, your patients grow old with you. And we know AMD in the age group 50 and older is the leading cause of vision loss. And if we look at our other medical patients, our glaucoma and our diabetic patients, you add those folks that are at risk for vision loss, add them together, they don't even equal the amount of folks that are at risk with AMD. So there are technologies now that we can pick it up early, and doctors really need to consider investing in those technologies to take care of their older population. So we have the myopia management with the young folks, we have our older patient population taken care of, and then guess who's in every age group in the middle? The dry eye patient. And so if we can have advanced technologies in our offices to improve our diagnosis and management of dry eye, that's every age group. We know kids now with the pandemic are in, distant learning. Those of us who are in the workforce, even optometrists are in telehealth and distance learning ourselves for CE. And so, the dry eye that topic is really at home with so many more people suffering from wearing masks and now being forced inside. So if you can improve your management of dry eye patients, you're golden, and you're covering all of the major things that can go wrong for our patients, and you really will grow your practice and help it thrive.
And I think it's important too to kind of recognize that this is optometry's wheelhouse. If optometry doesn't step in and do this, how are these patients going to get taken care of?
Oh, exactly to your point. So you look at our ophthalmology colleagues where residencies aren't increasing. In fact, their numbers are in a decline, and they're surgical, right? We're in the communities throughout the country. You'll always find an optometrist. So, and we're well trained. We know how to take care of these folks. So absolutely right. If anyone's going to take up the torch, it should be us, and I'm confident it will be us.
Mm-hmm. So what else should individual ODs, the profession in general be doing? What more can they do?
Well, we have two great organizations that really help us advocate for ourselves and for patient rights, and that's obviously the American Optometric Association. And then we have our great research education arm in the American Academy of Optometry. And so with those two forces that work so well together, they're very synergistic forces. When we're advocating for patient rights and for access to care, and we have the good science and research behind us, that gives us the tools we need to feel confident in talking to our patients and following through with advanced measures to take care of them.
Excellent. And it's also good for your business.
I've always said what's good for the patient and patient outcomes is great for business. And, that resonates well with patients. One of the other things that this pandemic did is there's other forces out there that kind of capitalized on online eye exams and saying, oh, your doctors are gone. Why don't we, come to us, we'll do a quick online exam and get you what you need. And, obviously that's not where we want folks to be. So when you think of the disruptors that are out there, no one can disrupt myopia management. No one can disrupt dry eye treatments. And no one can disrupt early detection of AMD and keeping our patients with better visual outcomes. That can't be done on telehealth. That can't be done on an online eye exam. So, we're doing the best for our patients. Those patients are in our care getting the best treatment, and then our practices thrive and grow.
Awesome. Dr. Lowe, thank you so much for your time.
Thank you, Marjolijn. Nice to be with you.